Hi, everybody, and welcome to our Facebook Live. We're here with talking about you qualify for Apple Health. What's next? My name is Mia McFarland, and then we'll do just a quick round of introductions. So I'll pass it to Roz, who I see next on my screen.
Half a day, Roz Leon Guerrero, she, her pronouns, and I'm with the Healthcare Authority.
Thank you. And then we'll pass it to Ariel.
Thank you, Mia. Ariel Partek, Healthcare Authority, she, her pronouns. I work with Roz in Medicaid eligibility policy. Thank you.
Thank you. All right, and then Clara. Oh, you're on mute.
Hi, my name is Clara. I'm a Pacific Islander. I work with Pacific Islander Board, a health board, and I'm a YAPIS navigator. Thank you.
Awesome. Thank you. And then Diela. If you can hear us. I know your connection's not great. Can you hear us, Diela? Uh-oh. Might be having connection tonight. All right. How about Renza?
Hi everyone, my name is Renza Milo. I'm with the BI Health Board and I'm working with the Chukis community. Thank you.
Thank you. And then Linda.
Yeah, hi. I'm sorry you cannot see me due to technical problem, but you can hear me, so that's good. Anyways, TGIF, Yahweh, Olive Romayo, and everyone. My name is Alinda Alik. I'm from Pacific Islander Airport. I work as co-file navigator and also as community navigator. Enjoy.
Right. Thank you. And then Pastas, can you hear us? Maybe not. Man, the connection is not having it today. All right. And then Priscilla, if you could introduce yourself to everybody.
Hi, I'm Priscilla. I'm from, I live here in Olympia, but I'm from Pohnpei, capital of federal state of Micronesia. And my parents are from outer island of Chuuk. So I speak both languages.
Yeah, and I still have to connect you to Renza here.
Yeah.
So we can find all the cousins.
So I didn't hear the beginning or these.
Oh yeah, I was introducing. We'll be doing the presentation on you qualify for Apple Health. What's next?
Okay.
Yeah. So we'll go ahead and go through that. I know. Okay, DL is having connection issues. Oh, that's rough. All right. So we're gonna go ahead, and we thought it would be fun today to just start with some trivia as something a little bit different that we haven't done yet. So we're gonna do trivia based on our last presentation. What is Washington Apple Health? And so if you're watching live, you can go ahead and comment if you know the answer to our trivia questions, and you can win a special prize. And the first person to answer correctly wins. And we have 2 questions tonight that came from the last presentation. No cheating, team. You can't answer. So we'll go ahead and go through those. The prize tonight actually is 2 $20 gift cards. So if you win the trivia question, you'll win a gift card. Very exciting. And then I'll message you separately and give you that prize. Okay. The first question is, what is COFA? That was something we went over last time. It was a good one. And it's something that'll be really important to learn about. And while we're waiting for people to answer, actually, Claire, would you mind just talking a little bit about your experience with Apple Health? If you can unmute. Claire, you're on mute.
I'm sorry.
Oh, you're good.
Okay. What do you mean by Apple Health Insurance itself, or
Yeah, like when you were enrolling, what was that like?
Yeah, when I first came here, I enrolled under Apple Health, and later to find out that I was not qualified. That's how I find out about COFA, and now it's good that they merged together. So
Right. And then what was your experience? Because you were on the COFA programs for a while and now you're on Apple Health. How do you like it?
it's good. I haven't used my benefit yet, but yeah, knowing that I have insurance is good. It's a good feeling.
Good.
No, I know I can be taken care of.
Awesome. I love that. All right. And then we got an answer in the chat. Someone said getting health benefits that fit our budget. That's a good answer. We're asking more like what does COFA mean? But that's close. I don't know. Should we give it to them? Francis said no. Compactor-free association. Yeah. Okay. Renza gives it a yes. Oh my gosh. Yeah. Renza's in charge of giving the correct
That's
answer.
close answer. So I mean,
Good enough. Yeah. Okay. All right, Nana, you win. So,
Not George.
Nana Jord. So, the Compactor-Free Association, like that she said, is an international agreement establishing and governing the relationship of free association between the United States and the three Pacific Islands sovereign states of the Federated States of Micronesia, the Republic of the Marshall Islands, and the Republic of Palau. Yeah. Ooh, and then we got another good answer. This was a good one. So the Compact-Free Association Islander programs provide health and dental coverage for eligible islanders transition to Apple Health. That's true. They are transitioning to Apple Health because of the restoration of Medicaid programs. Very exciting. Awesome. All right. And then the next question is, what's the best way to get in contact with a PIHB navigator if you need help with your Apple Health application? So we talked about this last time and the presentation before that. There's 3 different ways that we can get, like you can contact us. So we'd love to hear those 3 different ways. Oh, Dale is back. Very exciting. All right. In the meantime, is anybody doing anything fun this weekend?
Can you hear me?
Yeah.
Hi. Okay. So maybe while we wait for question 2, maybe we could talk about, because that one person said COFA Islander programs provides health and dental coverage. Maybe you could talk about the difference between COFA, the Compact of Free Association, and the COFA Islander programs with the health and dental care.
Oh, that's a good idea. Yeah. Do you want to go ahead?
We can give it to Renza.
come again. I'm sorry, I didn't hear that.
Yeah, I think people often mistaken the Compact of Free Association, right? That's the compact with the folks from communities or individuals from the Federated States of Micronesia, the Marshall Islands, and Palau. They have a relationship with the U.S. That compact, that agreement with the U.S., right? So that's what COFA stands for, Compact of Free Association. And it differs from the COFA Islander programs, that's the health and dental. And when we talk about the COFA Islander programs, that is managed by the Healthcare Authority. for those that are not eligible for Apple Health may be eligible for the COFA Islander programs. Ari, did you want to add on to that?
No, you captured it perfectly, Roz.
Yeah, I thought we talk about the difference between the two because most people often mistaken COFA, the compact, as health insurance or the program, the health and dental program. So I thought we talk about that just a little.
Yeah. That's a good distinction. Thank you. Okay, we do have an answer, but oh my gosh. Oh, there it is. Okay, so this is a good one. Thank you, Alana. So Zoom meetings and Facebook. That's true. We do Zoom meetings, and we can be reached through Facebook. But it's close, but not there, because this is the one of the correct answers. So call the toll-free line, and they even have the number ready to go. I love that. Alinda had suggested the question be, what is the toll-free line? And I was like, Alinda, I don't even have that number memorized.
I can answer that to win.
Right? I was like, I was this close. Yeah. This close to memorizing it. Yeah. All right. So you've won the gift card, and then I'll go ahead and message both of you about the gift cards. Yay. Oh, that's very exciting. We're all learning. And so we're going to do this at the next presentation too. So pay attention well today and tune in next time. And we'll have trivia next time also. All right. And that's okay. Yeah, this is the rest of the slide. So how to get in touch with our navigators. So you can schedule an appointment at pihb.org/COFA Health to meet us on Zoom. You can call the toll-free line that we talked about, or you can even come to our in-person events. I know we're thinking about going back into person in the spring, so keep an eye out on our social media and our website for updates on when we'll be doing that. And we'll be doing an update on these during these presentations on what we'll be up to. All right, at this time, I'm going to go ahead and pass it to Renza.
Can you hear me?
Yes.
Okay, our agenda for today is the client responsibilities, how to apply and make changes to your account, what are managed care plans, how to select a managed care plan, provider one and managed care plans card, how to find a provider, unpaid medical bills, HPF requested additional information, question and answers, resources and survey.
All right. Thank you, Renza. And then we wanted to talk a little about just about your responsibilities as someone who has Apple Health insurance. So these are some of them. So you have the responsibility to help make decisions about your healthcare, including refusing treatment, keep appointments and being on time, and calling your provider's office to let them know if you're late or cancel an appointment. Give your providers information they need to get paid for providing services to you. Bring your services card and health plan ID cards to all your appointments, and we'll go ahead and cover that a little bit later. Learning about your health plan and what services are covered. Using your healthcare services when you need them. And then I'll move my head. Know your health problems and take part in making agreed upon treatment goals as much as possible. All right, and then we've got give your providers and health plan complete information about your health so they can give you the care you need. Follow all your providers' instructions for care that you've agreed to. Use your healthcare services appropriately. And then you're going to want to inform your health plan and the Washington Health Benefit Exchange right away if your family size changes, if you have pregnancies, birth, adoptions, or your circumstance changes. So if you change addresses, change incomes, or you are eligible for Medicare or other insurance. And the PIHB navigators can help you with that process too if you're not sure how to get into your account. And the last one is renewing your coverage annually using the Washington Health Plan Finder. So that is another thing that the team can help you with is renewing your coverage when it becomes that time of the year. All right. And then Renza.
How to apply or make changes. Where to apply for Washington Apple Health. You can go online to the wahealthplanfinder.org or the mobile app. Download the WA Plan Finder app. Phone number is 855-923-4633. Or you can submit a paper application for healthcare coverage. Or with a PIHP navigator, schedule an appointment at pihp.org, call for help, or call 888-308-7113. Need to make changes to your current plan? With PIHP Navigator, schedule an appointment at pihp.org, call for help, or call 888-308-7113. What are managed care plans? Managed care is a term used to describe the healthcare organization and plans that provide medical services for Apple Health Medicaid. Each managed care plan contracts with network of healthcare providers such as hospitals and additional You are able to choose a managed care plan in W Health Plan Finder after are still eligible for Apple Health. If you do not select a managed care plan, one will be automatically assigned to you.
Right, Alinda. Linda, can you hear us? You're mute.
Is that me? Okay. All managed care plans will cover with same basic services, such as appointments with a doctor or healthcare professional for necessary care, medical care in an emergency, maternity and newborn care, mental health services, treatment for chemical or alcohol dependence, pediatric services include dental and vision care, limited dental and vision care for adults, prescription medications, laboratory services, hospitalization, transportation to and from medical appointments when necessary, and provide also interpreter for your appointment if you do not speak English, and they'll arrange it through your provider, and COVID testing. So following services are always covered by Apple Health without a managed care plan. Dental care, vision benefits, long-term care, inpatient psychiatric care for physician services. Some health plans have also additional benefits. These benefits might include gym membership, free cell phone, or others. And you can view additional benefits at pihealthboard.org/co-islander-outreach-information.
All right, Clara. Oh, you're on mute.
Managed care plans, AmeriGroup Washington, Coordinated Care Washington, Community Health Plan of Washington, Molina Healthcare of Washington, United Health Plan Community Plan. United Healthcare Community Plan. And these are the region that all the plans are covered under. And that's, all the county. And this is our 2021 Washington Apple Health rating for all the health plan. It's AmeriGroup Washington, Coordinated Care of Washington, Community Health Plan of Washington, Molina Health Card of Washington, and United Health Community Plan. And you see the stars above average is 3-star, average is 2-star, and below average is 1-star. That's the
Oh, yeah.
plan report card.
I should also add that this will be on the PIHB website also.
Oh, okay. You will receive 2 cards in the mail, one from Washington Apple Health, the service card, and one from the health plan that will manage your care. And this is how the card looks like. Provider 1 service card. About 2 weeks after you enroll in Washington Apple Health through Washington Health Plan Finder, WashingtonHealthPlanFinder.org, or Washington Connection, WashingtonConnection.org, you will receive a blue service card, also called a Provider 1 card. A few weeks after you enroll in Apple Health, you will receive a health plan ID card as well as more information from your plan about how to choose a doctor or primary care provider. And these are all the card provider.
Awesome.
Going to the doctor without a card, you will receive a letter that tells you your health plan. If you need to go to the health care provider or fill a prescription before your cards arrive, take your eligibility decision letter on your Washington Health Plan Finder account or in your email with you to the healthcare provider or pharmacy. You can go to any doctor, health clinic, behavioral health provider, or pharmacy as long as the provider is in your plan's network. Contact your health plan for a list of providers.
All right. Thank you, Clara. We lost Diela. So I'll go ahead and go over her slides. And so how to find a provider. So to choose a primary care provider, follow the directions sent to you by your health plan or call your health plan's member services phone number. You can also choose a primary care provider through your health plan's website. So there should be a phone number on the back of your card that we went over, on the back of this card that you can call from the health plan. And if you don't choose a primary care provider, your health plan will select one for you. And these are the managed care plan contact phone numbers. We've gone ahead and put them. So if you know which health plan you have and you want to contact them about questions or help finding a doctor from them, here's all the phone numbers. So AmeriGroup, Community Health Plan of Washington, Coordinated Care, Molina Healthcare of Washington, and United Healthcare Community Plan. And so those will be their main phone numbers. Or you can go to their website and do a little looking around too. And that would be also the same phone number you can call to ask about additional benefits. And then, so how do you have previous unpaid medical bills covered? So if you're eligible for Apple Health, you may be able to get help paying for unpaid medical bills if they've occurred within the last 3 months prior to your coverage start date. So if you were approved that month, make sure you tell the hospital that you went to that you now have Apple Health coverage, and they can look up your account and make sure that information is updated. And to get previous months covered, you should indicate on your Apple Health application in the Washington Health Plan Finder that you have unpaid medical bills to qualify for retroactive medical coverage, and then they'll help you take it from there. And then if you've received a letter requesting additional information, I know that happens like if you don't have certain things like your social security number at the time you apply. So you'll get a letter in the mail and potentially also an email from the Health Plan Finder, and verification can be provided by uploading the document to the Health Plan Finder account in the Document Center, mailing it to HCA-MEDS at P.O. Box 45531, Olympia, Washington. You can email apple@hca.wa.gov or fax it to 1-866-720-2892. So if you have questions from the Health Plan Finder pertaining to Apple Health only, you can call the Healthcare Authority Medical Assistance Customer Service Center at 1-800-562-3022, or you can call a PIHB navigator with any questions at 1-888-308-7113. And now is a great time to mention, if you're getting any mail from the Health Plan Finder, please open it. It's going to be very important to open all your mail just in case they want additional documents or they need to confirm income, things like that. And there's the navigators that can help you and these phone lines if you have any questions or unsure. All right, and then if you have any questions or concerns about your coverage, we are able to help you with applying for Apple Health, renewing your coverage, updating your contact information, which is one of your responsibilities as a customer. So address, email, and phone number also are things that we can update. Any questions you have about your account or application. And then how to get in touch with a PIHB navigator. Like we said earlier, you can schedule an appointment at pihb.org/COFA Health to meet us on Zoom. Or you can call our toll-free line at 888-308-7113. And this is staffed by our PHP team and interpreters available for Chuukese, Coast Ryan, Marshallese, Palauan, Pohnpeian, and Yapese. All right. I'm going to go ahead and bring everybody back on. Just trying a new system. Okay. So there's the comments on Facebook of questions. If anybody has any questions too from even like our team, like we can take questions. We'll start. Oh, this is hi Esther. Esther's just saying hi to everybody. Let's see. And then, so this question, does Apple Health cover vision and dental for adults? And I will pass that one to Alinda.
Yes, it does, but it's limited. You Rise and Ariel can add up more.
You got it, Linda. Medical, vision, and dental are Apple Health benefits for adults. The difference would be dental and vision. You're only going to use your Provider One Services card. For medical, you're going to use your managed care plan card as well.
Perfect. Awesome work. All right. Any other questions in the comments? We'll give it a couple minutes. Here's a good one. I recently acquired a second job. Does this change my eligibility status? So I'll start this one off. So it doesn't have to. And so what we talked about in the last presentation was that there's income limits, and we can show that. And so it's depending on how much you're making at that second job, it could change your eligibility, but it doesn't necessarily have to if you're still under that income limit that Washington Apple Health has. Yeah.
Can I add on?
Absolutely. Yeah.
Okay. So the first thing is we don't know if anything changes until you update your application. The team on the line can help you do that. In Health Plan Finder, if you wanted to try it on your own, there's awesome calculators that you can use when you are adding income. So if you don't know what your monthly income is before any taxes are taken out, there's a calculator that you can use where you enter how much you earn per hour and how many hours a week you work, and then it does the math for you. And then to the other thing we want to talk about is when you have to report a new job. So you are, for Apple Health, you need to report any income changes of $150 or more, and that's a monthly amount. So if your income changes by $150 or more per month, and you expect that change to last longer than 60 days. So if it's going to go on for more than 2 months, that is when you have to report that income. And you just have to report it within the first month that you get that income. And again, the folks here on this presentation can help you do that. If you wanted to, you can also go, there's multiple ways to do it. In addition to having help from the people here, you can do it yourself online. You can call Health Plan Finder. There's even a mobile app that you can download to make those changes. And then the final thing I would say about income changes is right now we are in something called a public health emergency. And so because we are in a public health emergency because of COVID, Apple Health recipients are maintaining their coverage regardless of an income change that might put them over. So if you report an income change that might temporarily close your benefits, it should open back up because we are maintaining Apple Health coverage for people during the public health emergency. There's only 3 times really when it should close down for Apple Health through Washington Health Plan Finder, and that's if you move, if you don't want it anymore, or if somebody dies.
That's
Threw a lot of information at you, but yeah.
No, that's actually, I think, really important for people to understand, especially with COVID and the public health emergency going on. That's really important. Thank you. Okay, and then this is actually a good one. So actually, I don't know the answer to this, but Esther asked, do you know why my 46-year-old mute and deaf sister was taken off Medicaid through DSHS and told to get insurance through the Washington Health Plan Finder?
I do not. I don't either. That's something that you would want to call DSHS and ask them. Anytime somebody might be terminated, they should also receive a letter with the reason why. So that would be another place to look. To get coverage through Washington Health Plan Finder is, I'm going to say a quick process. Sometimes it feels like really long process because there's a lot of pages to get through. But again, there's multiple ways to apply through Washington Health Plan Finder, including getting help from the folks here on this presentation. And if you have further questions, again, you can call DSHS or the customer service line, the Apple Health customer service line. They might have information as well.
Yeah, that's true. And then one big update is that I know that DSHS is starting to move back into their offices and doing in-person services. So you should be able to visit your local DSHS office during some hours of the day. And if you're not getting an answer on the phone line, which I know has been happening every now and again because they're so busy. Very exciting. All right. And then, so which form do I file with my taxes and where can I get that? Alinda, I know you know the answer to this.
The 1095A form, you can call the plan finder too, and someone that can help you also, the navigators, they can do that too.
Yeah. And then I think if you log into your WA Health Plan Finder account, you are able to go to click view 1095 forms from the dashboard or going to your message center when you log in, and you're able to download and print a digital copy of it once you sign into your account.
And I think for clarification, so you use the information on your 1095A form to complete the IRS 8962, and that's what you attach to your IRS form 1040.
Man, tax season.
Yes.
So
Good
fun.
question, and I appreciate that it comes up at every educational event because I think everybody should hear it. We do get a lot of questions about it, so good question.
Yeah, and we did create a tax filing flyer for people that had tax credits. And so that can be found on the Healthcare Authority COFA webpage, and it is translated in all 6 main COFA languages. And so that is hca.wa.gov/COFA. And so that has the same information in addition to some free or low cost tax resources, so tax filing assistance.
I have a question from a community yesterday. An elderly woman, she doesn't have job. Like, for example, all these elderlies, they don't have job. They're just, and they have this question like, is it important for them and is it a must for them to file that form?
That's something that they would want to talk to a tax professional about. I don't want them to get into any trouble with the IRS. So again, on that tax filing flyer, we have resources where they can call and ask those questions.
Yeah, that's true. And I know there's a lot of assistance for free tax help at this time of year that can help you answer those questions about taxes. That is a great point. All right. We'll take another question. All right. So I took my daughter into the ER. I received a billing. Do I call Melina, who's my managed care plan, or do I call HCA? Ooh, that's a good question. Alinda or Clara? Maybe you know the answer?
Am I mute again?
No, you're on now. Yeah.
I'm gonna pass that on to Alinda. I can answer better.
We can take it too.
Yeah.
Yeah, that we're here
Yeah,
to support you.
Yes, I'll give it to Ross.
Well, first, if you received a billing and it shows that you owe and you know that you have Apple Health, you would want to call the billing department and ask if they had billed Apple or your insurance. If they had billed Molina. That's the first step you want to take.
Okay. Call billing department. Thank you.
Yeah.
Because if you call me, I will tell you the same thing, to call the hospital's billing department and ask if they've billed your insurance.
Yeah, that's a good point.
But that's a really good question because we've been getting these questions. And we've had people call a few times asking about this. And I believe people who have gone to the ER in the past few months have been getting the same billing. So it's good to call the billing department and ask if they've billed the insurance. And then if they have and it came back, then you call your managed care. Call Molina. Is that correct, Ari? They call Molina, or they can call the customer service.
Yeah, so I would say if they've billed Molina and maybe something's getting denied, I think that's the next step, is to call Molina, find out why it's being denied.
Yeah, that's a good point. That's true. All right. And then, Alinda, you posted a question. So this is from community. Can I purchase a plan for dental while I have insurance through my job? I guess the first question, maybe Alinda, you can expand on that. Do they have dental insurance through their work, or just like, is it separate plans? No dental insurance?
I don't know. He was just, I was trying to help him and he wasn't able to get it through Apple Health. But that was his question. Maybe this one is for Ariel and Ross.
So not eligible for Apple Health, but wanted to purchase dental insurance?
Yeah, he wasn't able to get Apple Health, maybe because he have insurance in it through a job. But
That would not deny somebody an adult for Apple Health.
he's not an he has a job, but
Okay.
I applied him and you just want to fix his teeth, like dental. You just need that.
Oh, so you just need the
Okay.
dental plan.
Okay, so what I can speak to is Kofa Islander Dental Care. And so if somebody is, so there's two ways to get to Kofa Islander Dental Care. The first is if you have Medicare, you might be eligible for Kofa Islander Dental Care. The second is if you have Kofa Islander Health Care, you can have Kofa Islander Dental Care. If somebody is working and has insurance through their employer, they are probably not eligible for tax credits. And so that would mean they are not eligible for Kofa Islander Healthcare and therefore ineligible also for Kofa Islander Dental Care.
Okay.
Whether he can purchase that dental on his own is another issue. And if you took him through the application, it would, in the eligibility results, let you know if that is a possibility for him.
Thank you.
Do a little bit more digging and try to get that answered. That's a good question, though. Like if your work doesn't cover enough of that benefit, or like I know some jobs don't cover glasses, but maybe that's something that people can get separately. It's a good question. All right. Any more questions in the chat? Any comments? Or even if our team has any questions that have come up? I think one thing that hasn't come up in these, but is coming up a lot when we go out is what happens if you either don't receive your managed care plan or provider one cards in the mail, like what you should do then. So we're definitely going to cover that in the next presentation, just talking about any concerns or issues that might come up with your care. That'll be covered, and especially with the cards. And we'll probably do maybe a little bit of segment on the 1095. All right.
I do see a question that came in right at 5:01 from, are we still able to enroll?
Thank you. Oh my gosh, that disappeared in the comments. So yes, Apple Health enrollment is open year round. So you can apply with our navigators anytime during the year, and we can go through your Apple Health application. The items that I'm going to say this maybe hopefully correctly. There's the open enrollment period that happens towards the end of the year. That's when you can get a qualified health plan or get into the Kofa Islander programs that we keep talking about. And so that would be then. But there's also special enrollments for circumstances like you have a baby or something else in your household change. I believe moving counts also. Like if you are able to move, like you can get a qualified health plan if you move. So there's those different times that you can get a qualified health plan or enroll in the Kofa Islander programs outside of that enrollment period. But for Apple Health, that's year round. Yeah, thank you for calling that out. I almost missed it. That's a good question. Okay. Oh, this is a good one. All right. Thank you. All right. I have someone that signed up and is on Medicaid but needs to remove her tooth, and it's around $600, and to save it is around $3,000. How can we get her signed up under the Kofa Dental, please, and thanks? Ooh. Well, we started to answer that. Maybe Roz, you can just talk about like what the process of just getting like Kofa Dental programs is, but yeah, you'd have to do a special enrollment to be able to do that. So there'd have to be circumstances, I believe, for that to happen.
So, Roz, do you want to take that? Here, I'll start and you chime in. Okay. Mm-hmm. Okay. So for healthcare, if you have Medicaid, you typically, and then you say, I don't want it anymore, you are typically not able to get tax credits because you are technically eligible for Apple Health. And again, if you can't get tax credits, you can't get Kofa Islander healthcare, and then in most cases, you cannot get Kofa Islander dental care. So in this case, if somebody has Apple Health Medicaid, they would need to find an Apple Health provider. And if a service like extractions are, I'm going to say typically covered. I know that there might be a circumstance where it might not be, but in most cases, it's usually covered. And then you should not have to pay any money when something is covered under Apple Health. When you want something done that is not covered by Apple Health, that is when you will receive a bill and you will be responsible for it. Roz, anything to add?
And I just want to repeat again, because there was a follow-up. Can we sign her up, or how does it work? If she is eligible for Medicaid, she won't be eligible for COFA. And what we could do, and Mia, what you could do is put up providers that accept Apple Health for dental. And that on the resource page, so they could look for a dental provider that accepts Apple Health.
That's a good point.
Mm-hmm.
Yeah.
We'll have to find out. I know that on our Healthcare Authority website, we do have a list,
Yes.
but a lot of times it's just about calling a dental provider and asking if they take Apple Health.
Right.
Correct. And maybe we can link that, Mia, so that they know where to go.
Yeah, definitely. That's a good point. There's a lot of dental questions this week. Very interesting. Awesome. I'm glad we're getting some dates covered. All right. I think that's, if there's any more questions, please put those in the chat and let us know. Otherwise, I'm going to continue on. If there's any questions while we're finishing up the PowerPoint, then we'll go back for them. All right. And then, so like we were talking about, so that resource page, pihealthboard.org/Kofa Islander outreach information. And that will have a lot of these resources. We'll start working on the dental resources also, because I think that's really important. And then more information. We'll grab that tax sheet from the HCA website and make sure that that gets on our page for another place that folks can engage with it. And then just how to apply for Apple Health. I know we went over this earlier. So at the wahealthplanfinder.org, you can download their mobile app or give them a call at 855-923-4633. You can submit the paper application or with a navigator. So you can schedule an appointment at pihp.org/Kofa Health or call 888-308-7113. And then if you're over the age of 65 or older, have blindness or a disability, you should apply at washingtonconnection.org. You can give them a call at 1-877-501-2233. Or now you can go in person because they're opening their offices back up. And so you can go apply at your local DSHS office. And then I posted a survey. I'll repost it in the chat. Just let us know how these presentations are doing. If you have any suggestions or comments, please let us know. I'm going to post that right now. If you could take a minute just to do that and let us know how you felt about it. And then finally, here's the schedule of future Facebook Live events. You can also watch them on YouTube if you're a YouTube person. And so we are right now, you qualify at Apple Health What's Next. So on March 10th, we'll be doing how to approach problems and who to contact. And so that'll have a lot of questions that we've heard over the last couple months from community. March 24th, we'll do renewing coverage. And then April 7th, we'll cover qualified health plans and COFA Islander programs for folks to understand what some of those are. Ooh, and we do have a question. I'm gonna stop sharing real quick. All right. All right. If I need to see a doctor after hours and it's not emergency, who can I call? Ooh, after hours. That's a good question. I mean, maybe Ariel Roz?
Roz, you got this.
That's a good one.
If you need to see a doctor after hours and it's not an emergency, who can you call? We know that the immediate care and urgent care has been filled. We know ER will not accept you unless it's an emergency. Have you all looked at your health insurance cards, your managed care plan? They have a number on it that you can call for after hours. Or even on your brochure. If you all look at your welcome brochure, it tells you that you can call after hours.
I want to have something, and a lot of people, especially my community, always call me to check like where can they go for like medical attention. So go to your card, Apple Health card. You can call that customer number and or like a service number. They will find you a clinic to go to take care of you and all that stuff.
I was waiting for Linda to chime in.
Oh my gosh. Yeah, she knows all those kids. And kids always have emergencies. And especially during COVID, I know it's so hard to get emergency care because of how many cases are in the emergency room. So that was an important question to cover. Oh man.
Yes, so most of the managed care or the managed care plans, you will see that they have, like AmeriGroup has the 24/7 care options, and they have a nurse's line. I believe Molina has the same thing. So you will want to read your welcome booklet. It's very important. They have some great information, and if you've not done your assessment with your managed care provider or plan, you should do that with your managed care organization. You should do that. It's very important.
Yeah, that's true. And that's one of the resources you can find on the HCA website is a Welcome to Apple Health booklet that you can look over. It has a lot of the information that we cover and even more items that we haven't covered yet. There's a lot of information there. And so that you can just view that online on your phone. That's what our team did when we were training. We read through that whole booklet. Very helpful. Okay. I'm cracking up because people keep falling off our live one by one. Well, I think that's all the questions we had. Please join us March 10th. We're going to talk about a lot of, and then please bring your questions of like questions you had about your coverage or anything about Washington Apple Health that has come up. Because we're going to cover all of those questions and things that we've heard, and some of the solutions to the common problems that we keep hearing about. And otherwise, thank you everybody for tuning in. And then people who won the gift cards, I'm going to message you.
Yeah, I have a question. Are we gonna have any what are we gonna do next? Like
It's
on our next
covering issues in the issues with your coverage or any of the questions that we get throughout the year. We're going to cover those.
and do we have a guest to come and talk about his experience? Are we
Well, I believe that you might have a guest, actually, Alinda. Would you like to tell us about?
Oh, she just have a question earlier. Her name is Marlise. She would like to talk about and educate us about like what she went through, and she helped someone, and then how they get it and all that. Our bills were covered, and it was a lot of thing to do. But she'll talk about her experience and her friend. What about Trisket? Is he gonna come up?
He can't. Let me ask him. But yeah, so Marlise is gonna join us. So
Yeah,
Marlise, invite your
Marlise, get
family.
ready.
If you want to watch Marlise on the on the Facebook Live, you gotta join us, and you can win more prizes and
And
see our
music.
beautiful faces.
Roz, you're gonna g- prepare music for us.
Oh boy, Olinda. Alinda.
Guamanian Chamorro music.
Alinda, you can also share your stories. You can share your experiences because you have some great experiences to share. You should think about that. Mia, you should have Alinda start it off.
I like that. And your songs, Alinda.
I will pass that to Clara.
Oh
Bring
my
your
god.
ukulele, Clara. Entertain us.
All right. Well, somebody's preparing music next week. All right. We'll see. Well, not next week, in a couple weeks, but we'll see everybody on March 10th. If you can join us, we'll be here at 5 p.m. with the whole team, with a special guest, supposedly music. But thank you, everybody, for tuning in, and we'll see you next time.
Thank you, Roz and Ariel and Mia and Clara.